Thank you, Naxa. Al Sutralam Kulatara Maikisna. I greet you in my language, the language of the Miskito Indigenous Peoples of Nicaragua, and thank you for the invitation. In Latin America and the Caribbean, there are more than 800 indigenous people, with a population close to 60 million, that are characterized by wide socio-demographic, territorial, and political diversity. Include more than 200 people in voluntary isolation, more than 100 are cross-border peoples, and there's an increasingly growth of urban settlement. We continue being younger than non-indigenous, but there's an also high rate of displacement, migration, and although rurality is still prevails, as I mentioned before, we are growing in the cities, especially in Chile, Peru, Mexico City, and due to several factors. And among these, the expansion of the cities. The cities are growing and growing into the communities, voluntary displacement or in search of employment and education. They're being expelled from their territories. And of course, soil degradation, water scarcity, and environmental disasters due to climate change. There's a big difference of indigenous peoples. In some countries, there are 40%, like Bolivia or Guatemala. And in some countries, we are only 10%. But for example, Mexico have 27 million indigenous people. And they represent 20%, 21% of the population. Or for example, 8 million in Peru represent 26% of the population. Now, the territories of indigenous peoples contain around 1/3 of the continent's forest. And this represents 14% of the carbon stored in tropical forests around the world. They also host wild fauna, flora, and play a key role in stabilizing the local and regional climate. All of this has influence on the demographic of indigenous peoples because of mining and other type of concessions over their territory. Despite all of this, indigenous peoples have diverse ways of organization. We are organized in our communities, in our territories. We have national organizations. Indigenous women have organized also themselves. And this whole process of revitalization has strengthened the ancestral structure. And the strengthening of these structures, in some cases, has made it possible to incorporate components of spirituality, of codes, of symbols, everything that we have been talking about, traditional knowledge. Latin America is the region in where we have advanced more in the recognition of indigenous people's rights. More than almost all of the countries have constitutional recognition of indigenous peoples. In some countries, we have even advanced in the recognition of self-determination, self-determined autonomy. I live in an autonomous region in Nicaragua, and we are celebrating this year our 37 years of building our process of multi-ethnic autonomy that recognizes collective rights of indigenous peoples and, of course, collective rights of our territories. Indigenous peoples, usually when you hear us talk, we talk a lot about living together in harmony, in community, taking care of our own ways of life. This principle of living together and living in harmony is the basis of what we can call our health system. Our health system. So we get sick, or our community gets sick, when we lose that balance. when there are the external elements that come and break the harmonious relations that we have between people, between other beings, between the spirits, between all of the different elements of nature. So the indigenous concept of health articulates physical, mental, spiritual, and emotional elements from both the individual and the communal point of view. And it involves political, economic, social, and cultural aspects. Traditional health systems in the communities are complex and quite structured in their content. And we call it system because it includes prevention, promotion, rehabilitation, treatment, healing, a lot of different elements. And they are based on living, as Elifu had told us, if we live on our territories, we have all of the knowledge system that help to really make that health system work. So in Latin America, in the last, I'd say, the last 30 years, we have struggled a lot to create intercultural health system. From 1993, in the International Year of Indigenous Peoples, we were able to define together with the Pan American Health Organization the first principles of intercultural health system. And this, what we call intercultural health system, is the articulation, the coordination between the state public health system in general and the practice of health system of indigenous people. And this really, of course, this creates a lot of challenges because our belief of health, if I get sick in a community, it may be the spirit of the Liwamairin, or it may be the spirit of the Unta because I went into the forest, the spirits of the dead, the owner of the mountain, the protector of the water. They are the ones that those spirits can go into the body of a woman, of a baby, because, and it's related with what is hot, what is cold, the body is hot, the body. So that relation. But also the stars, the moon plays an important explanation of why the harmonious relation can be altered. There's a lot of belief around poisons, negative energies, and other type of elements that can change the situation in the community. So when a baby has diarrhea, for example, in Peru, well, the doctor can, I'm a doctor, I'm a medical doctor, but we can say, okay, microbio. No, but the community say it's because the spirit came into their, or it's cold water. So each one of the different diseases has different ways of addressing it. So intercultural health experiences in the regions, we have 14 countries that have already created institutions to address intercultural health. Bolivia has a vice ministry of intercultural health. In my regions, we have modelo de salud intercultural that have been defined from the community that combines traditional health system with the Ministry of Health, but it's managed in the autonomous region. And the main approaches have been the promotion of medicinal plants in one. The second approach has been joint delivery of official and indigenous medicines. In some clinics, in some hospitals, in some regions, for example, in Ecuador or in Chile or in Mexico, you can go into a clinic and you can ask for either traditional attention or you can get an Occidental, a Western attention. But after several years, we have agreed that the best approach is what we call the coordinación en paralelo, the complementarity. The two systems has to have a whole type of political support, policies and support both systems. And there's a referral and contra-referral system that you can move from one system to the other. The coordination is the one that promotes traditional medicine, and at the same time, it offers access to Occidental medicine, Western medicine, to indigenous persons that require. For example, I had cancer. Well, I had to go through mastectomy, and you cannot get that in the traditional health system. But I received my traditional medicine at the same time. So you complement both of them. And we have seen a lot of intercultural health public policies that have been developed in the countries. I think COVID-19 was a great experience. We were able to document more than 100 different types of medicinal plants that were used not only to prevent COVID, but also to strengthen the immune system of the members in the community. Now, in education, the concept of education is how to strengthen the knowledge in the next generation. How do you teach? How do you pass on that knowledge to the younger generation? And of course, that creates a lot of different point of view around school, because the school system has been the system that made us lose our knowledge. Whoever went to school left their community, left their knowledge, and went back. If they didn't go back to their community, they even stopped being an indigenous person. So we have also been trying to promote intercultural education system. And we started with, I would say, bilingual education program. But these focus mainly on language. But language is not the only element. If you do not change the curricula, if you do not train the teachers, you are not doing anything. I was the first chancellor of our indigenous university that we created 30 years ago. And the biggest problem that we faced in the university was our teachers, because all of our teachers came from other universities. They didn't learn, they lost all of their traditional knowledge when they went to the university. So we spent most of the first 10 years of the university training teachers to be intercultural teachers, teachers that would bring and complement the two systems, the traditional knowledge system and the Western system, to really educate the students. So we can say that language, training programs for bilingual professionals, programs that aim to formulate curricula in the different education system, and programs that are also have been trying to incorporate communication and new type of technology. For example, the youth in our region are trying to create applications to learn their own language that they lost. So these are some of the approaches that we have tried to promote in the region. One of the deficits has been higher education. We have been able to create more than 30 indigenous universities in Latin America. And of course, this is not enough, because the mainstream universities do not include traditional knowledge system. They do not invite our knowledge holders. So that's a deficit, I would say, in higher education. We have worked a lot in defining how to do intercultural research, because how to move from extractive research to intercultural research, a research that can really feed into our self-determination process, where we are the researchers but at the same time, together with the community, we build new type of knowledge. All of this is only possible if there's a recognition of individual and collective rights, if there are formal mechanisms of dialogue and participation of indigenous peoples, if there are normative framework and institutional mechanisms that allows this knowledge system dialogue. And of course, land, territory, self-determination are important components. You cannot advance towards intercultural health, education, or different knowledge system to interact in a respectful way if there's no self-determination, if there's no recognition. Thank you.